Hello, everyone. Good evening, and welcome to the success story of Dr. Mahajan. Let me introduce himself a little bit. Dr. Mahajan is from India, and he's a practicing orthopedic surgeon, and he's been practicing the orthopedic surgeries for past 5 years. So, Dr. Sachin, he reached out to me and he said, sir, I just want a help from you, and I just want to give this MRCS because, I wish to pass this one, and I want to go for further from the regular surgical career. So yeah, I said, okay, you can do it, right? And the rest of the stories that you're going to hear is from Dr. Mahajan. Dr. Mahajan, just introduce yourself and yeah, share your stories, like when you have passed the MRCS Part A and when you have decided to take this MRCS Part B, how much time you had for your own preparations, and also what are the course materials you have used, what was the tactics you followed for a very short period of time. If I'm pretty sure that everyone doesn't know you, so I can say he is a person greatly motivated, positively motivated, and also he took this exam very seriously, and he passed this exam with the first attempt, and with a very, very high marks. It's not a matter of joke. Like, he got a really, really good marks. So obviously he's gonna share all of his experiences with you, all of you. So Dr. Mahajan, most welcome to this session.
Yeah. Thank you,
And
sir.
first of all, congratulations for your
Yeah,
massive,
thanks a lot.
massive success with a very good amount of score, right? Okay,
Thank you.
so
Thank
Dr.
you.
Mahajan,
Yeah,
please go ahead. The floor is
okay.
yours.
Thank you. Hello, everyone. I'm Dr. Sachin Mahajan. I am orthopedic surgeon. I'm based in Mumbai, India. I have been practicing as a private practitioner since last around 8 years now. So I decided to give MRCS because nowadays there are a lot of corporate hospitals coming up in India, and generally they would prefer someone who having an international degree and some out of India experience. So I thought that I will give MRCS and then think about FRCS. So for the MRCS part A, I had joined a different class, and actually it was very difficult for me after such a long time of
Right.
practicing and to start studying again. So I just took some time and then I started part A preparation. And I joined a different class. It was that way fairly easy. Anatomy was okay for me because I do orthopedics day in and day out. Only issue was the abdomen and the thorax anatomy, and part A also had physiology, pathology, and everything. I gave the part A last year in April 25, 2025. I think the date was 29th April, and then got the result in the end of the May, and I could clear that also in first attempt. By God's grace, I just passed through, not had a really good score in part A. Then we had this. So there are a lot of free groups in Telegram going on about MRCS. So I had met Dr. Shrenik in that group. We had discussed about part A preparations and everything. And honestly, uh, I would also owe a lot of my success to Dr. Shrenik. He's been a really good friend,
Right.
good mentor, guide, and so he did a lot of research on the classes and everything, and uh, he motivated others. He made some WhatsApp groups and Telegram groups and asked others to come on, let's practice together. So and that then we had we had regular calls and we were in touch, and then we decided to contact you and think about joining IMG. So there were always a few other options, but we thought that we'll go with IMG because we had a lot of other people giving us good feedback about this class, and I'm sure
Right.
that feedback was right. Yeah. Now I can say that it was very right, and it was
Right.
it was good for me to join this class.
Mm.
So I joined this class. So we had this session starting in mid of July, And so then there were no. I used to attend the regular classes as such, which the schedule the ethics sir has given us. Then somehow I think there was some family issues, so we couldn't continue the classes in between regularly. Uh, should I answer this question right now? Yes, I did class for part A. That was a different class. It was all online class only.
I think Dr. Samir Bakri is asking this for to me.
Okay. No, IMG does not have any class for.
Yeah, we
I
started.
Okay, you started. Okay, okay,
Yeah.
very good. I was not knowing that. I think I was knowing there was some other class which had a tie up with you. I had joined
Yes.
that group also, uh,
Yes.
but somehow that batch I couldn't join because I got late for that batch.
Yeah. Yeah. Yeah.
Uh, I saw your photos. You had attended their part A,
Yeah.
I think, felicitation program.
Yes.
So yes, so that I got to know about that very later. So here in Mumbai, there are some classes which are like the post regularly comes on Instagram,
Hmm.
and so I joined that. Then for part B, I took the preparation really seriously.
I can
Then I
say
mean
that.
because yes, I mean it
Yeah.
was very see. I mean for sometimes giving an exam to a computer is easy. You have to just click,
Yes.
but giving an exam and speaking in front of unknown people.
Physical exam is different.
Yeah, and that is not one or two. You have to like do 17 stations.
Right.
So you have to, it's a, like a fast-paced exam, 17 stations at one go, and you have to speak to 17 people. So it does require a lot of practice. And so I thought we'll join these classes. Then we all joined the classes. We regularly continued. Unfortunately, I couldn't give the mocks in the knowledge section as much. I was working. I'm still working. So and I was not able to study. I used to study regularly, but like bits and pieces, not thoroughly. And then there are no exam centers opening in between. But then suddenly this Kuala Lumpur session opened in January,
Yeah.
and Shrenik was like very excited. Okay,
Yeah.
let's do this. Let's do this. Yeah,
Yeah.
and I have not given any mocks as such also, and I will ask Dr. Atik first that if I can give. So I asked you, and he was like, "Okay, wait for some days." Then again, after a couple of
Yeah.
so, but fortunately, that Kuala Lumpur had nearly a 1 month of window. I think there were a lot of
Yeah.
candidates,
Yes.
and it had one month of window for to book. So a week passed by. Again, I asked the same question. Sir said, "If you have a lot of money, then you can join." Yeah, it is a money-intensive exam.
Yes.
Now as a if I go back, I can recall. I mean, like I could relate that it is a money intensive exam because
Yeah.
sometimes you pay so much, you pay for travel, hotels, bookings, etc. And then if you fail, then it really does pinch you.
Everything is like done, right?
Yes, yes. So, and if you fail, say by a couple of marks or something like that, then I mean, even if you have a lot of money, it still pinches you because it is
Yeah.
significant amount of money.
Yeah.
So then I decided that okay, no, I will study seriously now.
Yeah.
And since October, November, I started studying very seriously.
Yeah. And I think like,
So
that was an eye opener for you as well. Like I can still remember in every mock, after every mock, you were just like, texting me, sir, should I book the exam? Am I ready? So I was
yes,
saying,
yeah,
no, wait, you're not ready yet. You're not ready
yeah,
yet, right? And at some
yes,
point, after seeing your dedications and after seeing your progress, I thought like, yes, now you are ready. You can give it a shot, but it will be a 50-50 chance if you
yes,
can remember, right?
yes, yes,
So,
yes.
so
So
like
and
when
I
you
think
were you
Shrenik
were
also.
hurting, yeah, when you were just hurting those things, I think like that put a fire inside of you, like why I cannot give the exam, right? Why
Yeah,
Dr. Atik is like, discouraging me to attend this exam. I need to step up. I need to like, do a little bit of more practice. So I think that
yes,
like,
yes,
had a fire inside of you and you like step up so much and at some point of time after like 1 month or after like 1.5 months and just before the exam like 1.5 months before the exam when I have taken your marks and you are just like mind blowing, you're doing excellent, and that time I said like, no, Dr. Sachin, what I said, now I can say like, yeah, you can give your exam and you will pass this exam, right? So it's
Yes, yes.
your
So that
hard work.
no, no, but that motivation is required. So hard work is there, but sometimes you need a lot of motivation, and you need also a lot of help from other people.
Right.
So, and I think that Shravnik was like constantly book the exam. I will talk with him then.
Mm.
And that in that live session, in that class only, we both discussed with you, and you said, okay, let him book. Shravnik was like, okay, we will prepare together, and then I booked. It was just towards the end of the exam booking window,
Right. Right.
and and then we decided that we will. So he had made some schedule, and we decided to follow that, stick to the topics, and then that motivated me. So every day I used to do around 2 or 3 hours at least of practice.
So you have studied for 2 to 3 hours every day for how much? How many months?
Since about last 3 months every day, but
Hmm.
before that it was like on and off 1 hour or so every day since last 6 months.
Right. So on an average, you can mention, okay, for past 6 months, you have given at least 2 hours minimum
Yes,
for this
yes,
exam. Okay, because many of the candidates has their these questions in their mind. Okay, like how many months I need to study and for how many hours I need to study, right? So being an average student, if I can count on that, so you can have 6 months and if you can spend like 2 to 3 hours, and I think like that will be fine, right?
yes. Sir, for me, my experience with the exam was like, I think most of the candidates who are appearing know the exam format.
Mm.
But for me, what I feel this exam generally test, the examiners see that uh, you as it's a surgical training and it is equivalent to a postgraduate surgical training exam, because GMC categorizes it, categorizes
Yes,
it as postgraduate exam.
yes.
So the examiners see that you are competent enough. The student is competent enough to go and speak to the
Start the,
patient and
yeah,
check patients from the next day.
right,
So
right,
So this exam generally for the preparation, you need to be consistent. You need to have competency, that is the knowledge that is to be gained by the lectures that you attend and practice. And is the confidence.
right.
I
Very
think what
important.
matters is the confidence. That way you present yourself, you talk to the examiner, you talk to the patients.
Right,
So that impression that gives to the examiner that okay, this guy is ready.
right.
And then these examiners generally are because from the day of my exam I heard that some examiners, other people were not liking, but I did not find anyone like that. I
Yeah.
did all my sessions very well. So
And that's why you got a lots of high score, right?
yes, yes. So I
Yeah,
can boast now a bit that I got a good score. But
yeah,
so when giving the exam, you are so everyone is nervous. Everyone, it is tough for everyone, but it is the confidence that you carry during that 3 hours
mm,
that defines your score. So if we consider all the people giving are doctors, all have knowledge, but it is the way you present yourself.
correct, correct.
There
Yes,
are some people who might not agree about the English, but I do feel that conversation skills and English and communication skills are
it's very
really
important.
important. Yeah,
Very
really
important.
important.
Yeah,
Hmm.
it's an communicating exam to be
Yes,
honest, right?
yes,
So like if you cannot express your like thoughts, what you're thinking about your thought process, about your mind mapping. So how you're going to approach to the patients, how you're going to talk, and all that. Like all of your gestures will change if you're constantly translating inside of your head, isn't it?
yes,
So you will be sluggish, you'll be slower, right? Who are
yes,
not thinking of other things, like who are not translating inside of their head, right? So you'll be
yes,
much more in the upper hand if you don't have any issues with your communication, right? So it's
yes,
very
yes.
important. It's very much important that you need to have a very better understanding of the English, and as well as like not only the understanding but also like to you need to
Conversation
have a
skills.
proper fluencies, right? So
Yes,
you need to be very, very smooth on the communication. So you will have an upper hand if you have the proper knowledge and the proper tricks. Yes, absolutely. I agree with that.
Yes, sir. And thing that I have heard and I have observed is that I think, say, if we consider ourselves instead of examiner, so examiner has to also, so they have a sheet in front of you. They have to ask the same
Mm.
questions and again,
Yeah.
and they are also being judged. There is a camera in front of them also, and they are also being judged. So if the examiner has to ask same questions repeatedly every day for say 40, so there are 20-25 candidates in one session. So two sessions, 50 candidates. He has to ask the same questions. At the end of the day, he is also going to be tired
Yeah.
asking the same questions. So he is going to look for the one word or the way you express and the way things are easier for him also to market.
Yes.
So if you take a lot of time thinking and if he cannot complete the questions only, then the examiner also bothered that, oh, these questions are not completed. And so the examiner generally look for candidates who are good with communication and who are really good with their expression, and they go with the flow as fast as possible
Right.
because they are also being judged. So I feel that as it is a comparative exam, like it's a percentile based score, every year the score becomes different. So for the candidates who are practicing, I would suggest practice more and more, be thorough with the English, and be thorough with the mocks. Like we have good amount of mocks going on this classes plus the QRC, and I've heard now Shrenik and Chirag are taking it. It's a good platform for them to for the candidates to take advantage of,
Yes.
because nowhere in no classes you get such a platform to give mocks or you get such a good feedback. Plus, this class also gives you unlimited support till you pass. I hope everyone passes in the first attempt and does not
Yeah.
need a support. But
Yeah.
still, that is a very good, and you get adequate feedback from you. I mean, sir has given me very good feedbacks and adequate feedbacks for all the mocks. So when we used to practice, I used to like I had discussion with Shrenik. There was Kritika. Then there was Dr. Amani. Unfortunately, she couldn't clear it. So we used to discuss that I was a bit slow, or I used to speak a bit slowly. So I used to go back and listen to the recordings again. What was wrong? What was right? So everyone was like, everything is good, just be a bit faster. So I went so fast that knowledge stations, all my stations were completed like in seven or
5 to
some minutes.
6 minutes. Yeah.
Yeah, 6 minutes. Yeah, after the
Yeah.
first bell, nearly all were completed.
Yeah.
I was just setting.
Yeah.
Same with the history taking stations also, both were completed very fast. Clinical examination, I had cranial nerves, which had like they had given a long list which was to be done and it was not to be
Yeah.
done,
Yeah.
and it also got completed very fast.
Mm.
So in many of the stations, so the sheet that examiner has, I mean, even if you give wrong answers, they mark zero directly, but they move on to the next question. But what happens is that when you are giving an exam properly, in the next page, whatever marks you get, the examiner has an
Yeah.
impression of pass,
The
fail, or borderline.
Pacific. Yeah. Yeah.
So even if you score 14 and if he feels that you are passed, then comparatively with the other candidates, you are passed. So
Yeah.
that's why the comparison matters, and it you need to do well. I mean, in that exam, not like okay, I will just think that I will get up to 15 marks and I'll pass. But if you aim for 15, you might I mean, get lower. But if you aim for the more marks, it will be better. Because if it's a comparative exam, if and in that single day, in that single session, if there are candidates like, I mean, just an example, not boasting, but if there are people like me, Shrenik, Kritika, the ones who are good in communication skills, they are in your
Yeah.
session,
Yeah. True. True.
and then the other candidates will really be in a
Yeah.
soup.
Yeah. Yeah, exactly. So, yes, it's very important. It's very important to step up your communication skills. Yeah, it's very important. Yes. So, perfect. Dr. Sachin, so is there any trick that you have followed, like when you are studying with us, like, during the class, before taking the mocks or during the mocks, did you follow any pattern of studying or practicing? Is there any specific or special tactics that you have followed which have, like, given you a extra boost to pass this exam very easily?
So regarding the knowledge section, so I was pretty confident So, I mean, we had discussed strategies with, Shrenik, and we all have discussed strategies in the past. So, for the knowledge regarding anatomy, the classes I attended, I tried to, I mean, 90% of the classes I attended regularly, 95% of the live classes. And then immediately next day, I saw the recordings again.
Yes.
And I made a point that I go through the notes faster. So I went through the notes couple of times. And then there were other people sending me materials. Shrenik was the most active one, but I, fortunately or unfortunately, I couldn't follow much. I just followed some of them. But IMG lectures of anatomy, I mean, I can vouch for you. They are the best lectures. In one, I mean, somewhere around October, where I decided that, or November, that we decided I will give the exam. So November was a busy month for me. Like I used to go in the morning at 7 o'clock and used to come back in the home at 10 o'clock. But I still made a point to study. So in that, during the day, what I did was that I had put, so in my car, I never had a phone holder or a car charger because it
Mm.
was like near distances only. So I had put a phone holder and a car charger, and while traveling, I used to
Yeah.
listen to this anatomy mocks or anatomy videos. Uh, so on an average, if you listen at 1.5 speed,
Yeah.
that video is over in about an hour or less.
Yeah.
So
Yeah.
while going and while coming back in the morning, so it was very fast and very good for me to listen to anatomy.
Yeah.
So I think I would have listened about at least, I mean, even if I am not undersaying, but at least 8 times I would have listened all the anatomy at least. And same for the critical care. I used to listen at least 3, 4 times. So after listening to lectures, then I used to listen to the mocks also. So what I followed was that I used to pause the video when the sheet for the questions came up,
Mm.
and then I used to answer these questions myself. For the critical care, at least when the sheet came up,
Yeah.
I could see the questions. I would pause the video, then I would answer all the questions myself loudly,
Mm.
and I used to see how I am faring with that, and then I used to listen to the candidates.
Yeah.
So I did that for most of the knowledge part. I had thought that I will do very well in anatomy and critical care as per my preparations. But unfortunately, we had a tough stations. I mean, I had two tough stations in anatomy.
Yeah.
So the thing is that for the candidates, the examiners are very specific. They just want a 1 or 2 word answer. Most answers are 1 or 2 words, not more than that. And they wait for you to give answer. If you are giving, it's a tick mark yes. If you're not giving, it's a zero. So in my exam, so there were like, uh, so the one was very easy for me. That was shoulder. So there is a 1 minute gap in between when you listen to the when you first read the stem outside. So there were candidates we had talked before. So when I was going in, that candidate was like, "You are going to do well in this exam, in this station." So when I went, it was already a moral booster for me. So
Yeah.
when I went inside, it was shoulder, and I was very excited to answer it very fast. Then that examiner only told me, "Okay, take a break. You are doing well. You can go a bit slow. If you speak anything wrong, I'm not supposed to tell you, but if you speak anything wrong, I have to give you a zero mark.
Yeah.
But
Yeah.
I
Yeah.
can see that you know it and you can still do it very easily." And even after giving a bit of time, I could finish that session in around 6 minutes, that
Yeah.
shoulder session.
Yeah. Yeah.
And
And
but
like,
the next post,
all the questions you already know, right?
yes,
So
yes.
everything is known
So
for you.
no, so yes, for everyone, I mean, I have seen the other materials also.
Mm.
So there is only a different way of presentation of the materials of, say, study material of probably IMG or Salah, whatever it is, or there's one more Turkey. I think I did not see. All is available in the internet everywhere.
Yeah.
But 95, 99% of the study materials has the same content. It's
Yes.
just the way of putting it up and down. The questions are
Yes. Yes.
here and there. Otherwise, all the study material is nearly the same. I
Yes.
mean, I could say 100%, probably one or people might sue me for that. It is not same, but it is near, all the materials are nearly the same.
Yes.
But what happens in the exam is examiner does not ask you according to 1, 2, 3 questions. He
Right.
asks you in a different way. In pathology, this time they had two stations which were combined together, like the aortic stent. For me, it was aortic stenosis and thrombosis,
Right.
uh, thromboembolism that way. So that station was combined together. So I mean, and the exam was like I didn't feel that I was giving an exam. We were discussing. So I mean, it was literally my couple of stations were like that. So there was a long stem written outside about an 80-year-old. So generally, what happens is that all the stems that were written were very long. I mean, it was a full page stem. So
Yes.
you get 1 minute. So I did read that stem about that 80-year-old lady having aortic stenosis. It is the same stem that is available everywhere. So when I went in, there was this lady examiner who just I. So what point that I made was that I wished. So I went with confidence. I smiled at the examiner. I gave everyone a proper good evening, good afternoon, and then I sat down. And then they asked the stickies from you. So for the people who have not given an exam, you get an iCard wherein you have a candidate number written,
Yeah.
and you
Yeah.
get small stickies
Mm.
which you have to stick to the examiner has to stick on the sheet. So what happens is that I found that some candidates were rushing to just give that away or throwing that away for the examiner to stick. I think it is not professional because they are also humans and it is our
Yes.
exam. They are taking our exam. So
Yeah.
I just took it. I mean, I just went in very normally and I just gave him and he sticked it. And he was himself hurrying. She was himself hurrying. So I said, it's okay. It's hardly a matter of 10-20 seconds. Not
Few
going to make
seconds. Yeah.
much
Yeah.
of a difference. Yeah. So then when you are calm, the examiner also feels that, okay, you are calm and their approach to you immediately changes.
Yes.
So in other stations, what I saw was that candidates were just giving away, the examiners were sticking themselves, and then it feels a bit odd. I mean, what is so much hurry that if you cannot do it in 9 minutes, yeah, you're not going to do it in 10
Yeah.
seconds more.
True. 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 True.
So when you're that
It,
way
like,
calm and
this simple and very small gestures, this will have a bigger impact on the like the on the examiner's mind. It's very
yes,
important. Like, here they can understand about the overall professionalism from you as well, like how you're
yes,
dealing with the, like, on a stressed situation, like how you're dealing with those things, because like you are going to deal with a very very bad patients as well. You will be stressed out, so they're going to judge you on those things, like how you're gonna like deal with those things, right? So it's very important.
yes.
Yes.
So when I went in, and one more tip that I would like to give to the other candidates was that so most of the knowledge stations, the examiners ask you, have you read the stem? And they give you one sheet again if you want to read it again. They put it in hand and give it to you. But I heard that some people did not accept that, or some people said we are okay. But I would suggest better take it in your
Yeah.
hand, at least go through it. So if someone senior is giving you a sheet to read, it makes no harm in just going it
Take
through
it. Yes.
yeah, in a minute or so. Just read it loudly, a couple of sentences, and then they said, yes, sir, I have confirmed it with outside, and we can go ahead with the questions and answers. So what I've heard that some people did not do that. So somewhere I feel that also reflects your professionalism and your communication. And even if you answer all questions, but if you are answering in a like a broken English or improper way, the examiner will not get frustrated. But if you are answering properly, these all things do matter. And this
Right.
exam is very fast. So so this aortic stenosis station, I mean, I remember very clearly. So this examiner was like, okay, I said, okay, 80-year-old lady, and so she started smiling. I also started smiling. So she was like, okay, what do you think are the reasons for this? So I said a
Mm.
couple of. She said, okay, tell me two. So I
Mm.
said like congenital or a rheumatic heart disease. She was like, okay,
Mm.
we'll go to next. So next question. Now, as she is very old, we decided that we should not do any surgery. So what are non-surgical options? So the question was like a story. So I was telling her, okay, this we can do this TAVI, or she's like, okay, what is TAVI or what is TAVR? So I told
TAVR.
her that,
Yeah.
yeah,
It's
full
just like,
form.
it's just like the mock, right? It's just like the mock.
Yes, yes.
Like,
Yeah.
you
So
are
and then she
used to
also,
with that.
yeah, yeah. And then suddenly she was like, and then she said, now this lady's eye is undergoing a surgery. So I smiled and she was like, okay, smiling. I said, good for her. She's like, yes, very good for her. 80 years and going surgery. So we were having a conversation like that in the
Yeah.
exam.
Yeah.
And she was like, okay, now what can be the complications? Okay,
Yeah.
so if you give blood, what will the complications of massive blood
Transfusion.
transfusion? Yes.
Yeah.
And what, okay, what is massive transfusion protocol? So the questions were like this. I mean, one question I didn't answer, I couldn't answer, I couldn't recollect. She's like, okay, we will wait. I will put it on the later. You can answer the next. So everything happened, and in the last, she said, okay, now you're done. This question remains. So you have all the time till the bell rings and you can answer. Then I just waited for a minute. I said, ma'am, I don't remember also. And I was like, okay, how was it? She was like, I'm smiling. You should know that. I said, but I am not getting this question. Can you please tell me what is the answer? Now you can just pass off the sheet and just tell me because it's like making me nervous that I forgot this. So she's like, no, it's okay. You're done very well. And so I went on to the next station. So next pathology station was also similar. So this guy also, so I had greeted this guy when we had, so he was going into the station and he had some, his both hands are full, and I just went and helped him open the
Mm.
cabin door.
Door. Mm.
Yes. And so we just had exchange a smile at that time in the morning. And when I went in, it was the last station for him. So he was also very happy seeing me. He just smiled. I
Mm.
smiled.
Mm.
And then same, the conversation flowed. And the last also, I think there was one question again. So in all the stations, I missed only one question each. I don't remember the questions also.
Yeah, it's not
So
possible. Like, the
yes,
questions that you are not familiar with, you cannot remember
yes.
or you cannot recall that question. It's very like, I don't know why. No one can.
No one can, yes. So
Yeah.
this examiner was like, so this was a guy, he was like, okay, finally, last question. And he was like, okay, my last question also, my last day. My last question, last candidate is you. So we both were like,
Yeah.
yes, sir, it is my last station. So we both were smiling. And he's like, it's okay, I don't want to answer it. So he's like, okay, we close the sheet. So it was like that. That was a couple of minutes. I think it was only 6 minutes that the bell had rung. So 3 more minutes. So we were just talking. I was like, okay, from where? He said Sri Lanka. He's like, I'm not allowed to speak much. There's a
Yeah.
camera here. But I
Yeah.
said, okay, how was it? How was the experience? He's like, it was good. I'm smiling for you. All the
Yeah.
best. So for all the stations that I made a point was to greet the examiners when I went in. And even after the station, whatever station, however it went, while going out, I said, thank you for your time and have a good day. And I went out. And so it probably the confidence that carries with you during such times that the examiners just see. So couple of stations weren't up to the mark that I feel. So anatomy two sessions weren't up to the mark because so the examiner was, I just got confused in that. So there were images in front. We were standing, and the examiner was roaming around me back this side, this side.
Yeah.
He was like,
Yeah.
"Okay, what is this? Right side? Okay. So submandibular gland. Okay, right or left? Okay, what nose passes?" So all that questions I could answer. Then he was like, "Okay." He showed me the accessory nerve and okay, now demonstrate how to test for sternocleidomastoid. I said, turn on the opposite side. He's like, okay, which side you will turn? Just show me, show me, show me. So I don't remember what I said. And in that hurry, he asked me, what is this greater auricular nerve? I said posterior auricular. So I had answered 3, 4 questions, and then I said posterior. He said, what does it supply? I said the greater auricular nerve, and I said the nerve supply. Then he was like, but you said posterior auricular, and then he gave me a zero in that because you said posterior auricular. But I was like, okay, let's move on to the next question. So when you are confident enough that you can answer other questions, I think that zero sometimes makes you a lot of, I mean, gives you a bit of setback and it makes you nervous. But it is the way you handle that situation. That's what matters. Because when I finished the station, he immediately marked pass in front of me. I don't know what marks I got. Probably must have been 13, 14, or because that had queried a 2, 3 marks question. But
Yeah.
he still had marked a pass. I could see that. So what I feel is that being confident and not letting the other question affect the next question or the previous station affect this station makes a lot of difference.
Right. And also one more thing that one very important things you have mentioned is whenever you are going to enter into the station, you always greet right? You always greet the
Yes.
examiner, and you need to have a very, very nice smile in your face, no
Yes.
matter what, right? So it's a nice gesture, and also it is going to boost yourself, and it is going to give you a
Yes.
lots
Yes.
of confidence as well, right? So,
Yes.
and the examiner who is like, just assume like two candidates are there, one candidate is entering, and he's not like that much confident. He's like stiff, right? Not
Yes.
greeting with the examiners and all that stuff, and he's like, shaking and like very nervous and
Yes.
cannot answer those questions pretty easily. And in the other hand, like you, so you entered very calmly with a very confidence, right? And you have a very good smile. You greet the examiner. So you slowed yourself to have build confidence on them as well. And you have given a little bit of answers, and you're talking with them, you are communicating with them. So now the question is, the examiner is going to give the highest score to whom? Of course, to whom he was like, having a good time.
Yes.
Right. So it matters. Like suppose there are 20 candidates, and they cannot give the pass mark to all of the candidates. There is nothing like you cannot have 100% of the pass mark in a single day, right? There is a certain percentage of the
Yes.
passing. So these few things will change your game, right?
Yes.
So
And
these are very
yes.
important things. Yeah.
Yeah, and every day there is a difference. So in the first day, probably
Yeah.
in our day knowledge section it was 108, and I think Ritika's day it was 105.
Yeah.
So in every day it changes by 1 or 2 marks cutoff.
Hmm.
So
Hmm.
I think if the other candidates are doing well and if you are below that cutoff, then it makes a difference.
Yeah.
And one more thing, you have to have an eye contact with the examiner, with the
Yes.
patient. So what happens is that examiner is asking questions and you're looking here and answering,
Yeah.
and
No.
you're remembering and answering. Then that is a bit no. I think that body language is important.
Yeah,
And
definitely, because that doesn't show that you are confident enough, right? So you're like doing
uh,
like this and like looking here and there.
yes,
It's not a
yes,
good
yes.
gestures to
Yeah,
have.
yeah,
Yeah,
yeah, yeah. I mean, I have seen. I mean, I could see the because it was transparent glass. So I've seen
yeah,
other candidates do that, and it is really difficult for the examiner to just make the candidate focus again and again with the
mm,
same task. And if the candidate is doing this, or if he's thinking in between the questions, so because they have to complete the same set of questions in 9 minutes, and if they are also not able to complete the questions, then it is the candidate's loss if
yeah,
he's not able to answer that properly. It's hardly 1 or 2 words that they are looking for in the answer, and they just mark accordingly and they go very fast. And the thing to note is that if the examiner gives you something, I mean, especially the STEM, please take it, read it, just go through it, scan through it. Probably more than doesn't take half a minute or more,
yeah,
and
yeah.
it doesn't cost
True.
you. Yeah. And then in we had one fluid overload station, that the pulmonary edema station in the critical care. So in that he was giving charts of the blood pressure and the fluids and everything. So what I heard is that other candidates were having it difficult to read the charts, but for the people who already have a practice of seeing charts regularly, so examiner was seeing. I mean, everyone knows that it is going to be hypotension, hypertension, what it is going,
Yeah,
pulse is
yeah,
going to be.
yeah, yeah,
Everyone knows what is the theory, but examiner wants you to show you on that chart
yeah.
what is this. So what I got feedback is that other people are not able to read the chart only or show it what is this and what is that. So I think for other people, just go through a couple of charts online or anywhere and just see the charts and
Also in
make
the
sure that
in our textbook it is given. The chart has
yes,
been
yes,
given as well.
yeah, but there are a couple. There will, I think it was a different chart, but there are
Yeah,
people who don't see the charts or they are not
yeah.
used to seeing the charts with the pulse marking, the blood pressure marking. How do you read that? So or the SpO2 marking. So you have to read that chart and to show the examiner that you know. So this
So
exam is more about the
the better way of doing or learning about the charts is all of you, almost 90% of you are working in the in a hospital, right? So just go to an ICU department, right? Go to an ICU, just take a patient's chart, right? Because they
yes,
really
yes,
maintain their chart. So just take a look of that, and you will get to know where to look at and how to like have those informations out. Yeah.
yes. I mean, and then I think so you cannot escape practice, practice
Mm.
and practice for the. I mean, even for the knowledge, you have to give
Mm.
mocks with your colleagues.
Right.
Make a study group. Make a study group with person who you think is better than you. So I thought Shrenik is the best in our in our uh, batch. So we made that group. We Shrenik, Kritika was there. So we tried. Everyone was working, so we did try to study in between, give mocks to each other. So last month, all so some of my success I owe to Dr. Amani also. She also practiced with me, asking me questions and answers a lot in the last month. So we used to like push each other. So other classes, what I've heard from other student is that you don't share information. If you share, they will pass, you will fail. But I don't think it is like that. It is about collectively learning together and growing together. The more you discuss, the more you improve yourself, the more you help your study partner improve. So she also motivated me as like in the night I has to be like very sleepy. It's I'm tired now. It's 11 o'clock. She's like, doctor, wait for 15 days. After that, you can sleep as much as you want.
Yeah.
So she motivated me a lot. And then, yeah. So all the study material, extra material that I got I mean, in the end, few days was from mostly from Shrenik and some from Amani. But I stuck to only the basic. So for the most of my candidates, I would be advised to study the basics. Generally, 90% of the questions are going to be from the same study material. One or two questions here and there is not going to be. If you answer the 90% properly, you are going to
Properly.
pass.
Yes. Yes.
Yes.
So
And if you go stress more about the new questions, or if you stress more about what is going to come, then you'll probably forget the rest 90%. Then
yeah.
that is a
So
different challenge
you are going to
altogether.
have a tunnel vision in the end of the exam. That's the problem of
Yes.
the all the candidates, you
Yes.
know. Like they are always searching for, okay, here is a new thing, here is a new image, and then all that. Like it's a like massive things that you're going to have
Yes.
just before the exam, right? So now at the end of the exam, you will forget about the basics, like the 90% of them will be washed away, and you will be having a tunnel vision for those 10% only, right? This is
Yes.
not good. This is not good, right?
So
So I
yeah, I think
always
what
say
I
to all
want
of
to is
you, Dr. Sachin, remember, I always say, like, see, if you're gonna completely follow this, you're gonna have at least 90% will be coming. There's no doubt, right?
yes.
That is my word to you. But don't go for here and there, here and there. Don't do that, right? Everything you need to pass this exam, I'm providing. Just stick to this point and
Yes, and
practice.
yeah, and in fact, I did manage to score an average 80% in
Yeah,
both the sections. So 80% of in the knowledge as well as 80% in the skill section. So
yeah.
yeah, so 80% of I could, I mean, recollect. So it was more about recollecting on that day. So
Mm.
anatomy, I think watching the videos again and again, practicing it again and again. So if you are very sure about the video and 3D anatomy, any question or any image that they show you, I mean, you can answer that. Generally, most of the questions are very easy. I mean, you have to identify one, two, three, the way we do in mocks. There is not, I mean, much of a difference. Uh, one or two questions, just forget about it. If you are happy with the 90% and you are going to get 80% marks, you are surely going to pass.
Now, at this point, Dr. Sachin, please disclose your result. What was the score that you
Uh,
had?
so I scored 131 in the knowledge section, and I scored 141 in the skill section. That is overall 272 of the 340, around 80% of the marks.
Yes, yes, yes.
So one I
Do
so
you know that is a
analyze.
very high score, Dr. Sachin?
Yeah, I mean, now I can feel that it is. I mean, I could see the other scores of the candidates.
Yeah,
So we and Stanley were discussing scores about a few days before the exam. We were like, I was like, even if I pass by a couple of marks, I'm okay with that. And then
yeah.
somehow it turned out that I had a really good score.
Dr.
So
Shrenik also got the score, right?
yes, yes.
I didn't hear about his score yet.
Okay, sir. I think you'll ask him personally.
Yeah, I
Yeah,
will.
everyone.
I will. Yeah.
So we got the score the next day,
Hmm.
not the same day as the next day or day after the results. So I was also surprised myself that I could score this much. So thing was that I could recollect the 80% because I was revising that 80% or 90% of the things again and again, and I could recollect that during the exam properly rather than going for most of the things which are, I mean, new questions or which are different. So that made a difference. So me, Kritika, we also practice the same. I think she also passed. So we all nearly did the same things, and we could pass very easily with that.
Yes,
Uh,
yes, absolutely.
Amani just managed. I mean, she just passed by, failed by a couple of marks only. But I mean that practice. So most important is consistency of the studies and the practicing again and again
Mm,
and practicing your English. So what happens with our Asian people is that we translate it in our mind and then we speak it in English.
yeah,
So that is what thing that we have to let go. We
overcome.
have to
Yeah,
think. We have to think in English also, and we have to speak in English also.
yeah,
Probably the simplest way is reading a English newspaper, not reading the other news, but reading the editorial sections,
yeah.
especially what the editors write, not the sports news or the war news, only the editorial news. That is the best way. And then practicing in front of a mirror or camera and just recording your voice and just listening again and again, or listening to the mocks that you are giving. So you know what speed you're talking to or the way you're talking, and you could listen and then you could judge and improve on that.
Right,
that's
right, right.
that's what helped you in answering. In communications also, so same thing happened with me. I had a tough station in the procedure, that was a catheterization. So I think that examiner was tough for everyone, so I couldn't understand it properly, but I asked him
Mm,
couple of times, sir, is this, I'm not understanding this question. Is that what you are trying to say? He said yes. And then I answered it. So uh, I think more is communicating. If you don't understand, you can ask, but don't ask again and again. Examiner
mm,
gets irritated, but better to ask and answer and be sure what examiner wants to know.
right.
So
Absolutely.
that helps. Yeah. So for all the candidates preparing, being consistent, finding study partners, making small study group, giving mocks, giving the QRC. Yeah, QRC is a dedicated platform. Dr. Adiba and I forgot.
Dr.
I'm
Sylvia.
bad. Yeah, yeah. They both also helped us a lot. They gave good
Yeah,
feedbacks.
yeah.
Yeah, and that is what I mean. So every where you give mocks, you try to, so you take the feedback constructively. That the way you can improve. Don't think that this is the end, or this, if Dr. Atik gives you bad remarks, that is the end of the world. It is giving you because you have to improve. So once you improve, then only you will be better.
Yes,
So generally, we see the efforts of the candidates, but in this IMG, there have been a lot of efforts which have been taken by the mentors. I mean, Dr. Atik and other mentors, as well as other old students also who have helped. When the other candidates have reached out, they have helped them. And so these all collective efforts matter in the end, and that makes the success story possible.
yes, yes, absolutely. So yeah, you have shared a lots of tips and tricks, Dr. Sachin. That's a massive. I think like today's sessions, like as you are going deep, like and you are giving a like really like good insights of the exam as well, like how to take it and how to deal with this. Like it's fascinating to hear from you as well. Like especially the person I said in the very first place, okay, no, you cannot give the exam. Then I changed my mind and you passed this exam in the very first attempt in the first go, so it's a massive thing, right? So it's a very good to like understand from your perspective, from your candidate's view. So it's a very nice thing to have. Very nice. Okay. Any specific memory that you have during the exam, like that wasn't like, good, went well actually for you, or is there any specific areas, like particularly in case of the skills that you can remember, no, like I could have done this in this way or something like that?
Yeah, there are a lot of areas that I could have
Yeah.
improved if
Yeah.
I could. So in the exam, I had a calcium. So there are a couple of stations wherein I Generally, in all stations, I missed one question at least,
Mm,
but I did not let it affect the other stations. So I missed simple questions. So in one exam, in one was the metabolism, calcium homeostasis
mm,
station. So it was mixed of post-thyroidectomy station.
mm.
So he asked all the questions, and the end asked me, okay, what is the management? Sorry. So I could not remember calcium gluconate. I was just saying injection calcium, and I got stuck. I was like carbonate, citrate. Then orthopedicians remember more of calcium carbonate and citrate
Yeah,
malate.
yeah.
I couldn't remember. I was like, he was like, okay. I was like, I will tell you, sir. I said, I can tell you the dose. He was like, okay, go on. So I told his 10% in 10 minutes and everything. He was like,
Mm.
okay, you know that. I was like, what will the complications? Everything done. He said, now there are a few minutes remaining. You have not answered only the name of the drug. If you can answer what is calcium, it is good.
Yeah,
Otherwise, we can. I said, okay. I said, okay, thank you. And then he said, okay, wait till the bell rings, and we both were smiling at each other. So that was a very positive memory.
mm,
So my first station was of the communication with the patient, warfarin patient.
mm.
So we two candidates started early. So the way we went in, so it was like, so everyone was like, so they came and announced that two people will start early. So everyone was like shocked, who will start early? Well, like there were palpitations going on. I was like, anyways, you have to start either 10 minutes early or
Yeah.
10 minutes
It
later.
doesn't matter.
It doesn't matter. And they took my number. I stand up and I was like very happy. It's like, let's go.
Yeah, you're lucky.
Yeah.
You know
I
who
was
who
there.
starts who starts the exam in the first in the same day. He got lucky because like all the examiners are fresh, they're not
Yeah.
agitated. They will take whatever you're gonna give, right? So
Yeah.
it's a lucky thing to give the exam in as a first candidate in the day.
Yeah, and I was very happy, and I just went in. I took the notes properly, the warfarin. So, what I feel was that what I got feedback from others is that in that file, the name of the patient is there, the name of the consultant is there, and there is name of you also, the SHO. So
Hmm.
some people just introduce yourself as Dr. Sachin or whatever it is, but you have to introduce yourself as that name. So what I got from others is that they did not uh, remember or they did not read that name of ours what was written in that scenario. So
Hmm.
that is the point to be noted, that you have to look what is your name given in the file, and then you talk accordingly. So
Your
there are
positions
generally,
mostly your
yes,
positions, whatever the positions
yes,
you're
your
having.
position, yeah, and
Yeah.
there is a name written for you. So if you're Dr. John,
Yes.
it is written that you're Dr. John
Yes.
speaking on behalf of whatever it is. So you speak that way, and you make eye contact. So that patient was blind, but then generally you look at the patient, you speak properly, speak slowly, make eye contact. Your communication should be good, clear, and when you feel that the patient is not convinced after say 6 minutes of the bell is ringing, so you get a bell out 6 minutes, and then you know that there is next bell out going to be at 9 minutes. So what I heard from one of my other friends or relatives who have given exam earlier, they said that in this warfare station, say somewhere around after 6 minutes, if the patient is asking one question again repeatedly, that is not given anywhere, but you should say that probably there are some questions that I may not be able to answer you properly. I would get back to my consultant, or I'll again arrange a meeting with the consultant. Then I think that gives a satisfaction to the patient. So that statement has to be told in that patient. So for all the candidates, the warfarin patient was asking the same again and again. What if there are some unknown complications? What if you don't know any complications? So you have to tell, I don't know, I will ask my consultant. So some candidates don't feel to be,
Yeah.
or
Yeah.
collect that way. So I think that presence of mind has to be there. All questions are not going to be the same as books. Some questions I don't, you have to have that presence of mind to just answer
Yes.
that time properly.
Yes.
And even the history taking stations also. So the history and the two communication stations, they are clubbed together under communication. So of that 80 marks, I got around 70. That is around 90%. 18 marks each average. So I feel that just talking with the patient properly just helped me a lot. Even in the history taking station, everyone was saying it was a mechanical back pain, mechanical back pain. So that patient was smiling. She was giving history properly. I could complete all my histories by till the eyes in the 6 minutes. But I had made a point that I am going to ask these questions when I practiced. So I asked her, and she said she gave a history of weight loss, and I presented it as patient is having a history of weight loss. It could be a mechanical back pain, but I'll have to also rule out metastatic disease. So the examiner was very happy with that. The way I presented him, and he to ask me, okay, what all will you see? What all can
Mm.
you do? I said general examination and physical examination and the blood reports. So asked me a couple of questions on that. So these questions and answers generally everyone knows, but the way you present. So some people forgot to ask about the weight loss or anything, and the patient was giving a history of weight loss, and
Mm.
people were only presenting as uh,
Mechanical back pain.
mechanical back pain. Yeah, and then I think it becomes very difficult to explain. The examiner also feels that okay, this candidate has not asked the question only. So generally, the examiners also have a checklist wherein they have a few questions tick marked. As you ask questions, they just tick mark it, and at the end they give a score. And I think your discussion carries only 3 or 4 marks, whatever it is. But the more important is how you approach and how you answer.
Right.
So as I work in a private practice, I'm orthopedic. So for all the orthopedic histories, I had decided that I will practice the same sequence in my patients every day. So I did that history stations and even the clinical examinations. I also practiced similarly with my everyday patients. So in fact, my OPD patients are very happy that I am giving them more time and I'm
All
asking
the
them a lot of
patients is
questions.
getting 9 minutes.
Yeah, yeah, more sir, more than 9 minutes. It is like
More than
15,
nine
20
minutes.
minutes each.
Yeah, yeah,
Yeah,
yeah, yeah.
history is 7, 8 minutes and examination is again 7, 8 minutes.
Right,
So
right, right.
they are very happy. So, but then that is what improves your fine tune your skills for the final day. You
Yeah,
are not nervous if you know if you are doing it day in and day out. You know where to touch, you know what to talk, you know what questions to ask, and you know how to pace yourself. So I did that orthopedic practice, and some of the other patients in the hospitals I did that on the other department patients also. So for all those who are working, I think you should spend some time with the patients and ask these questions. And you can suppose that you are a RMO doctor or you're just a specialist who has come to take new history. So probably the patients are also more happy and they give you
yeah,
history properly. Even if you take in local language, but you have to practice that same set of questions and same set of examination again and again. That does make a difference. I mean, you have seen my mocks. I've got all sort of patients, all sort of hospital staff for the mocks and made them do my mocks in the live
right.
classes. So this makes a difference. One thing where I was stuck was I found not stuck. It was a scenario of nevus excision, wherein it was written outside. They had given that big stem that this patient has presented with the nevus, considering that the patient is already under anesthesia and is prepped and drept. You have to do the nevus excision. And in below there was one line written: candidates are expected to put one knot by the instruments and one knot by the hand. So a couple of candidates forgot to read that line and they did not put through the hand. So don't hurry, just read the stem properly and do accordingly. That is what I think. It that same station came in Hyderabad exam also, where candidates were asked to put by not by hand, and it was not that difficult. I mean, I could do it very well. I mean, I could exercise the nerves properly, and wound also got approximated very well. In spite of that being a bad pad, it was just the confidence that I carried. Everything went well. That lady also stand up and was saying that how was the wound. I was like, it was closed very properly. So
Nice,
sometimes
nice.
when you are confident and doing things properly, just luck favors you and things go your way.
Yeah, yeah, absolutely. Absolutely. Yes, yes. Very nice. Like, your sharing of thoughts is very nice, Dr. Sachin.
Thank you.
You are a very, very positive person, and you are spreading the positivity instead of, like, spreading the negativity. like many of the candidates will say, ah, no, this is very hard to pass. This is like that and all that stuff. But you're sharing the positivity, and this is much more possible if you're just gonna stick with the point of practicing the normal things and just doing that for like constantly every day with those things, so you can pass these things very easily on that basis. So it's a very good thing that
Yes.
you are sharing your thoughts in a positive way. Fantastic, Dr. Sachin. Okay, so at this point, I just want to hear from the candidates who are present. If you guys have any questions, Dr. Sachin and also me, we'd be love to take any questions. If you ask any questions, we'd be love to giving you the answers as well. So anyone, please, if you have any queries, just ask us, ask Dr. Sachin, and I think like he will be happy to share the answer as well.
Yes, yes, surely.
Hello.
Yes.
Hello. Yeah, this
Hi.
is Dr. Abhishek. I'm from Mumbai as well, and
Hi,
I'm
Abhishek.
an orthopedic surgeon. So
Okay.
after
Wow,
hearing to
so
your
much
lecture, I'm very
similarities.
much, yeah, exactly, exactly.
Yeah.
So it actually giving part B feels very difficult for me because
Okay.
I gave my part A in my residency itself. I'm doing my senior residency right now. So it was
Okay.
very challenging to even hear about part B and OSCE stations and hearing about abdomen and trunk and everything. So after hearing to your lecture, it feels really amazing and seeing you sharing the information, sharing the insights of the exam. It is very nice and like you're a very positive person and congratulations for your success.
Yeah.
Yeah,
Yeah.
he's
Thank
very
you. Thank
motivating
you,
as well,
Abhishek.
isn't it, Dr. Abhijit? Right?
Yes,
Sorry, Abhishek. Yeah,
yes, yes.
it's
Yeah,
Sir,
Abhishek, don't
actually,
worry. Have you given once or you're not
yeah,
given
yeah,
yet?
please. No, no,
Have you
no.
given the
I'm just
exam?
preparing. No, no, I haven't. I
Okay.
haven't.
Okay.
Yeah. So, yeah, I wanted to ask, sir, in anatomy, like, did you make any notes as such, or did you keep hearing the lectures itself?
Uh, uh, I mean, I did not make any notes as such. It was more of the
Okay.
video lectures and the books
It
that
was
are
just repetition of the lectures and the
yes, yes,
printed
yes. The
version of the
3D,
notes.
yes, yes. So as you're an orthopedic, I think most of the upper limb, lower limb would be familiar to you.
Yeah.
The
Yeah.
only difficulty is for me, it was more of brain and head and neck
Yeah.
and some sort of stomach and abdomen. But if you're doing it repeatedly and if you're just practicing the questions and answers again and again, so you have to give yourself some time to listen to that lectures and practice again and again. Then only it makes sense. Just don't rush through the
Exactly.
things. Yeah.
No,
So
yeah,
yeah,
because
yeah,
the way of studying for like we have always studied using the books and we had this visual memory of the things. So this is pretty much unconventional way of studying too. That is the reason I asked you this question that should I make notes or should I just keep on
yes.
listening
What
to the
see,
lectures more and more and
see every
practicing?
yeah. So every person is different. I mean, what
Yeah,
works for me might not work for you. What
correct.
traditionally you have been following, you should. For me, I want a book to be read in front of me, so I had asked for the IMG books. I had taken the books course with the books, so I used to
Mhm.
read from that books and I used to see the anatomy videos. But I told you I just, like saw every video nearly 7 8 times,
Yes.
and the same with the mocks and the books also. So and then I practiced answering that. I mean, alone or with my colleagues. So
Mhm.
that gave me that confidence of doing well in the other. I mean, not
Yeah,
non-orthopedic topics. So only thing is consistency. Consistently doing the same thing again and again helps you.
yeah.
Uh,
Thank you, sir.
and honestly, when I was doing my MBBS or PG, this sort of 3D lectures were not there. I mean, I would have been very happy if there were 3D lectures when I did my PG. I mean, this 3D is
Yeah.
mind blowing. You could just see all the anatomy and in the 3D properly. So, I mean, you could just remember it very easily.
Thank you so much, Dr. Sachin, for like praising in this way. And thank you, Dr. Abhishek, for asking and sharing your thoughts with us as well.
Thank you, sir. Thank you.
All right. Did
Thank
you book
you.
your exam, Dr. Abhishek, yet?
No, sir, I haven't. I've just started preparing. I haven't yet decided the
Fantastic.
date which I'll. Yeah.
Fantastic. Fantastic. So just like, start with the studying, and yeah, if you need us
Yes.
and if you need help, so just feel free to knock me, right? So I will be happy
Yes.
to help you as well.
Sure.
Don't worry about that. Okay,
Sure.
anyone else wants to
Thank
ask any questions?
Abhishek, knock me later. I think I have met you somewhere in the conference or somewhere like that.
you. Yes, sir. Yes, sir. I will, sure. Sure. Surely, sir.
Okay. Okay.
All right. Is there anyone else wants to ask or share any thoughts with us? There are many other candidates, Dr. Uday, Dr. Tasin, Dr. Simon, Rashidul, Dr. Noreen. Okay. All right. So I think, yeah, it was a very, very informative session that we had, Dr. Sachin, with you. And it's my, like, it's my pleasure to have you here and sharing your success. It's a massive thing for me as well. Like, and I wanted to do that because I wanted to share that particular point of saying no to you for giving the exam and then saying yes. And then you got a very, very high score. And that's a very, very, like, a very good feeling that I'm having for you right now. So lastly, I want to say congratulations. And
Yeah.
yes, of course, whoever is present here and whoever will be watching these videos later on as well, all of you can be in the position of Dr. Sachin, maybe in next couple of days, couple of months, or next year as well. But don't lose your hope and just try to practice. And we are all here, right? So if you need
Yes,
any
yes.
help from the IMG, if you want to take the course as well, always just feel free to knock me, even if you don't want to have the course, but just need some support, some like some of the advisors, we will be happy to help you always. Like I've been doing that for a couple of years now, like almost 4 years. So I will be happy to help you as well, right? So don't feel like, shaky, like should we reach or not? Like just feel free to ask for anything, any help, any sorts of things. And also like in our free groups, Dr. Sachin will be there, Dr. Shrenik is there, Dr. Chirag is there, our other course mentors are there. So feel free to ask anything and we'll be happy to help you. And you'll be sitting just like Dr. Sachin in next session maybe as well, right? So don't lose your hope and just go for this one. Have a proper mindset, give your 100%, and definitely you can score at this much in your exam and you'll pass with a very ease. Any last words, Dr. Sachin?
Yeah, I mean, that's it. Thank you so much. Thank you for the IMG group. Thank you, all the friends and the supports and the other mentors who have helped me. My friends, I mean, I could mention a few: Shrenik, Kritika, Mani, Lisa, who have helped me. And I would like, if anyone wants any help or can reach out anytime, and just be positive about it. Help each other. And you be positive. When you help each other, you also grow. That is the best way to pass an exam, rather than isolating yourself and thinking more about it.
Right.
When you reveal each other's success, you enjoy the success more.
All right. So, everyone, thank you for having us and thank you for participating into these
Yeah.
sessions. And see you
Thank you.
guys again with a new session, inshallah. All right. So, everyone, good night and assalamu alaikum. Stay well and take care. Thank you so much, Dr. Sachin. We are going to
Okay,
talk
sir.
and we will keep in connected. Okay.
Sure, sure.
All
Okay,
right,
sir.
Dr. Sachin. See
Yeah,
you.
yeah,
Bye.
yeah. Good night.